Hey everybody, it's Jody here. We are now on episode 11, 11, and we are talking about or answering questions that we see when we scour groups and message boards and Reddits in the world of dentistry. Now, uh, we see whenever someone has a question in dentistry or anything else, they jump into a group that is that topic. In our world, it's the dental groups or the message boards, and they ask questions in which all kinds of people give responses, and they get all kinds of different answers, and all of those answers they doesn't help them answer their question any better, because they don't know who those people are, what the priorities are, and so forth and so on. So what we wanted to do was go through and answer some of these questions that we're seeing out there, but from our perspective. So it's important we share our perspective. We're self-managed fee-for-service practice. Our doctor is doesn't really see patients so much anymore. The practice brings her joy. Our associates love their associateship. Our employees find meaning in their work, and our patients want to be part of our team. So we had this really, really special thing. We're very quality focused, hometown environment, and that's who we are. And what we're doing is we have launched Pugh Leadership Academy because we want to be able to reach out and help other doctors who've gone through the really hard times like Melanie has in her earlier years. We want to help them, give them a light, a pathway to be able to follow if they haven't found one yet that's working for them. So that's who we are. And we've been answering some of these questions in the podcast here. So we're going to take three more today. So I want to jump in, read these questions, and answer them from our perspective, from my perspective, without really spending hours of research on these. I just read these, picked three out a few minutes ago. So let's jump in. What should I do when my practice manager wants me to be more pushy with recommendations? Well, this is why social media groups and message boards are terrible for these types of questions, because there's no black or white answer to this. It really depends on what's going on. It could be that you're working in a practice that's very pushy and really sales oriented, and everything's about sales, 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 sales. Or maybe you're not working in that practice, but you are doing things that are causing patients not to move forward with treatment. Maybe you're thinking out loud, which is, one of the things a lot of times young doctors do is they're trying to think what they want to do, but they talk out loud, and it makes them look like they're not confident in where they're coming from. It could be that you're not using any sort of methodology in how you're communicating with patients. So it really all depends. So I would say if you're working in an office is just trying to sell, 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 maybe that's not the right office. That's something that you have to determine. If you're in a place where if your mindset is sell, 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 and their mindset is sell, 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 then you're not doing something right, because they're obviously your office manager's getting on you. But if you're a little more conservative and you want to just present treatment that you know is needed, and the office is very pushy, then that may be a mismatch. And that's something that you need to think about. Now, if the office is not real sales pushy, and the office manager is saying that, there's probably something going on with how you're communicating with patients. So you kind of need to identify what is the scenario and then deal with it. So if you're pushy and you're trying to sell everything you can, and the office is trying to sell everything you can, and you're not meeting their numbers, well, I don't know what to tell you, because I don't really agree with that methodology. I don't really agree with that philosophy. It's not anything I want to be involved in. If the office is just a good practice and you're not getting you're not being successful in getting patients to move forward with treatment, then I would say you really need to take a look at how you're communicating with patients. If you're just talking to patients, it's not really good enough. Like, you really need to take patients on a journey from understanding who they are, where they are, what their priorities are, what their current situation is, and what problem is there, and then what is the consequence of that problem, and then how are you going to solve that problem with them. That's the path. you go on. And if you don't go on this path and you just kind of talk like there's no linear pattern of direction of where you're going, then you're probably not going to be very successful. If you're thinking out loud, and thinking out loud meaning you're processing what you're thinking in your head with your mouth, that makes you look like you don't have any confidence, and that could be a problem as well. So it depends on the situation. You really need to know a little bit more to answer it, but hopefully that gave you a little bit of, actually, whoever wrote this question is probably never going to see this podcast, but if you are watching this podcast and you do have that question, hopefully this will give you just a little bit more insight into what direction you can go. Question number 2. Will I feel more appreciated working in private practice? Not necessarily. I don't think that has anything to do with private practice or corporate practice or public health. I really don't. Who are you? And this, obviously, I don't know that the poster of this question is ever going to see this, but I'll pretend they are. Will I be more appreciated working in private practice? Well, more appreciated by who? By your team or by your patients? I think, honestly, if you're talking about patients, this has a lot less to do with private practice versus public health versus DSO, and a lot more to do with, are you in network with insurance or out of network with insurance? Because one of the things that's really interesting, when we decided to go out and network with insurance, and we had gotten down to just had 2 plans left, but they were our 2 biggest. And we knew that when we finally went out and network with those last 2 companies, that our patients who said, I only want what my insurance covers, we knew they would go away. What's really interesting is almost all of the patients who were total pains in the butts with that kind of stuff, they all went away. Now, we still have challenging patients, and you always will have challenging patients, but there's something about the insurance patient base that's going to bring an element to you that is not always fun. Now, one thing to kind of like, if you take a step back and look at it and go, well, am I feeling that from a lot of patients, or is it just the 1 or 2 patients a week that are like that is really bringing me down? Sometimes you have to take a step back, look at the big picture, and put things into context. If you're feeling like you're not appreciated by patients every day, any day, whatever, I don't know if you're working in the right place, or I don't know if you have the right social skills for the job. These questions are really hard to answer without digging into that very specific situation. Now, if you're not feeling more appreciated by staff, I think that's a mirror. Like, if you're not feeling appreciated by one staff member, that's something that you need to take a look at with that individual staff member. But if you're not appreciated by most of the team, that's a mirror. You need to look in the mirror and see what's going on. Take the red pill of self-awareness and try to really figure out, what is it that I'm doing that's making this team not gel with me, or not support me, or not go on this, do this thing with me, versus they just do what they have to do. So that's a tough one too. I think that it really depends, and hopefully that helped a little bit if you're having that same question yourself. Question number 3. Do I have to be a good salesperson to be a successful dentist? This is kind of like getting back to question number 1. My owner doctor says yes. Is 1 year too soon to open my own practice? Actually, that's question number 4. We'll do 4 questions today. We'll hold that one off for a moment. Do I have to be a good salesperson to be a successful dentist? My owner doctor says yes. What do you mean by salesperson? Number 1 is what I would say. So if I were talking to this person directly, or if you have this same question, I'm talking to you directly, what do we mean by salesperson? I would say, do I have to be, a better question would be, or another question might be, do I have to be outgoing to be a successful dentist? No, not necessarily, not at all. Do I have to be someone who's a great communicator? No, not necessarily. What I think you have to be is someone who can listen to patients, who can make patients feel very comfortable, who can be gentle with patients, and who can communicate clearly the things that need to be communicated within the relationship of the doctor and patient. So, hey, did I listen to the patient? Is this patient feeling comfortable with me? Am I being gentle with this patient? Are they at ease? Have I built trust with this patient? And am I communicating clearly the problem they have, what that means, and how we need to solve it, and when we need to solve it? So, do I have to be a great salesperson? Well, you have to be able to do that. And that's really, I don't know, when I think of salesperson in this context, I think of people using, their selling skills or tricks or whatever. And I just think it's really a lot about trust and comfort and being hospitable and making patients feel very welcome and not having chaos and having good systems so that the patient is moving through the office from one place to the other and everything feels nice and smooth and calm and high quality, and then having trust. And whether you're backwards or whether you're shy or whether you're whatever, having the conversation that I was talking about earlier, get to know the patient, making it feel comfortable, listening to them, and being able to really communicate what's going on within the context of what's important to them. So hopefully that helps make sense. Is 1 year too soon to open my own practice? Yes. Yes, it is. It is totally too soon to open your practice. Now, do people do it and they survive? Yes. I would never, ever, 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 ever recommend doing that in 1 year. If anything, I would say, take 5 years. Take 5 years, because in 5 years, Melanie always says, it's 5 years is what it takes to really to get it. And so I would say I would never, ever, 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 ever recommend to anyone or suggest to anyone that they open a practice within 1 year. So there you go. We did 4 questions today, and I'm so glad you're here with us. If you have a different take or you agree with me, let me know. And if you can smash that thumbs up, as they say in the YouTube world, and subscribe, that really helps. We're really trying to get this content out so that we can help other private practice dentists who may be stressed out or struggling find a voice that might share some information with them that they would find helpful. All right, guys. Thank you. See you next time.